Hi, my name is Liz, and I'm going to be taking you through an in-service with the Puregraft Direct Harvest System today. We'll start by reviewing the Puregraft technology, then we'll get into a checklist of everything you'll need before your first case. We'll talk about how to set up the system, how to harvest, drain, wash, and extract the graft from the system, and then we'll talk about disposal and cleanup. Finally, we'll finish with some tips and tricks that you might find helpful before your first case. All right, let's get started. So the Puregraft is a sterile, closed system adipose filtration device. Puregraft filters out all the unwanted components of lipoaspirate, like blood, tumescent solution, lipids, and it leaves you with up to 97% pure fat for reinjection. The Puregraft devices come in a range of sizes. Now the technology is exactly the same across all the sizes. They're just sized for different types of procedures. So the 50 is really good for face and hand procedures. The 250 is good for face and breast procedures. And then the 850, which we'll be talking about today, is good for your larger volume body and breast procedures. So as I mentioned, Puregraft filters out the unwanted components of the lipoaspirate, leaving you with up to 97% pure fat. Now this is higher than any other adipose filtration device on the market or any other method that you can use. And what that means clinically is that because there are fewer contaminants in the graft, you're going to see improved graft uptake rates and lower complication rates with your patients. The other thing is that Puregraft was designed to be really simple. With our direct harvest system, you can lipo suction directly into the bag. And the other thing is because it's flexible, you can see it's really easy to get the graft out of here when it's time to extract the graft. So it's kind of like emptying out a toothpaste tube. You can just get it out really nicely. And then the most important thing is safety. This is a completely closed system. It comes sterile, it's single use, and it's been on the market for 15 years. So we have a really great history of customer satisfaction and safety behind us. So how does it work? Inside every Puregraft bag, there are two filters. There's the fine mesh filter and the coarse mesh filter. The fine mesh filter is what traps the fat cells. And this filter allows all the contaminants like blood, water, tumescent, lipid to just pass right on through. The coarse mesh filter is just a spacer. It helps all that waste fluid flow right out to drain. So the reason this 74 micron filter works so well is that it's specifically sized to capture all your mature adipocytes. Mature adipocytes are somewhere between 100 to 150 microns in size, and they typically exist in clusters. So you can see on this little graphic here, the adipocytes, these nice round yellow circles, they're going to get trapped by that filter. All your waste fluid is going to flow right out. You can drain it out, and all you're left with is your pure, mature adipocytes ready for injection. So as I said earlier, the technology is exactly the same across all of our bags. We'll start by talking about the 50 because it's the simplest, so it's the easiest to talk about. So this view just shows the Puregraft bag as if you were looking at it from the top down. The tissue port is on the front of the bag. The drain port is on the back. So what that means is that all of the fat is going to be captured up here in front of the fine mesh filter. None of that fat is going to make it to the drain. So you really don't have to worry about losing any tissue. And you can see on the 250 and 850 bags here, it's shown 250 bag has 3 ports and the 850 bag has 4. The only port that's behind that fine mesh filter is the drain. So any of those other ports you can use to access the graft. That drain port is back there. None of your fat is going to get back there. Sometimes we'll hear customers say that they saw some yellow fat-colored fluid going out the drain port during washing, and they're afraid that maybe they're losing some of that good fat that they harvested. You can see here That's really not possible. None of the mature adipocytes are making it past the filter. What that probably was lipid, and that's not something that you want in your graft. Okay, so now we're going to dive right into the direct harvest system. So this is a checklist of everything that Puregraft provides to you in our kits. So on the left-hand side here, this is the 850 filtration system kit. So it comes in a box that looks like this, and this is going to contain your Puregraft 850 bag, your drain bag, and 2 disposable combined adapters, which are used for the extraction step when you're getting the graft out of the bag. The direct harvest kit, which is the reusable kit on the right-hand side here. When you order that from Puregraft or from your rep, you're going to get the vacuum lid, which comes with the lid itself here, as well as the cap and the straw. Those are all part of one piece. You will get the instrument set, which includes this nice easel, which is a 2-piecer, as well as a metal slider, which is used to help you get the graft out of the bag. You'll also get this disposable canister here. And then the last thing you're going to get is the reusable combined adapter. I'll show you here. This is the same as the disposable combined adapters that come inside your Puregraft 850 kit. It works the same way. The reason I have this as optional on here is that you're getting the disposable ones with every single 850 purchase. If you lose this guy or it doesn't get sterilized, it's not the end of the world. You can just use the disposable ones that came with your kit. So something just to keep in mind throughout this whole process is the 850 is really the heart of the system. That's where all the filtration is happening. That's where all the important stuff is. The direct harvest system is just a tool to help you get the lipoaspirate into the system and help you drain a little bit. But all of our important steps, they're really happening inside of the Puregraft 850. So this is just a list of items that will need to be provided by you or your facility to use the Puregraft system. So you'll need a harvest cannula. We recommend a 3 to 4 millimeter cannula. Anything larger than that, you're going to get too big of fat chunks that are going to be really hard to extract from the Puregraft bag. You'll need a liposuction machine or another suction source. You will need tubing, and you're going to want to make sure that that tubing both fits onto the lid. The ports are like Christmas tree ports, so most tubing should work. You're also going to want to make sure that the lengths of tubing are long enough that this system fits into your process without disrupting your normal surgical setup layout. You'll need lactated ringers to wash the graft. You can also use saline solution, but we recommend lactated ringers. You're going to need lure lock syringes as well as catheter tip syringes. So if you're not familiar, this is what a catheter tip syringe looks like. Then you're also going to need cannulas for injecting your graft once you're done. All right, so this is step 0. We don't start with step 1, we start with step 0. This is making sure that you have everything you need in the OR before you start. So you're going to want to check that your direct harvest system is sterile and that all the parts are in the tray. I know there's a lot of parts. There's the canister, the easel, the slider, lid. This cap is something that often gets left behind, so make sure that you have everything ready to go. You're going to want to make sure that you have lactated ringers or saline, if that's what you're going to use to wash. You're also going to need either a lure lock syringe or irrigation tubing with a lure lock connection on the end for connecting to the Puregraft bag for washing. You're going to need your tubing and your suction tower or vacuum source. You will need the Puregraft 850 filtration system. It's always good to have a backup of these. They're individually wrapped in their sterile pouch. Just good to have a backup in case the case is larger than you expected and you need more tissue than can fit in a single bag or something gets dropped. Never a bad idea to have a backup. And then the last thing you're going to want to do is do a visible check of the direct harvest system. You're going to want to make sure there are no cracks in this canister. That's not something you're going to see right off the bat, but after a couple hundred reprocessing cycles, you might see some cracking. If you see that, make sure you get a replacement. You're going to want to check that the O-rings are intact. O-rings on the bottom of this lid, one O-ring here, and then there's another one on the drain straw there. And then you're just going to want to make sure that there's no damage that you can see to the straw or to either of these connection ports. All right, now we're ready to set up the system. So we will start by assembling the easel. This is a two-piece easel, and how you set this up is you just slide this together like that, set it down. And then you're going to want to insert your canister into the easel, just like that. Now, these pieces don't fully lock into place, so I'd recommend setting this up just exactly where you're going to use it. If you do have to move it after it's set up, make sure you just have enough hands on it so that you are making sure that nothing gets dropped. All right, I'm going to move this easel out of the way for now so you can see everything better. All right, so now we are going to move on to the PG850 bag. So go ahead and open up your kit. Pull this bag out. So you are going to remove the aux and drain caps here and set them aside. Do not throw these away. You will need them later. Good rule of thumb with Puregraft is never throw anything away until the end of the procedure. Set these aside. You can put them with the drain bag and combined adapter because you'll need them all at the same time. Now we're going to grab that drain straw and insert the drain straw into this drain port here. Do that carefully so that you don't puncture the bag, but you're just going to screw that in so it's nice and secure. Now we can take a look at this lid. You'll see on the lid that there is a call out for the drain tissue and aux port. You can see that here. You can look at it on your own lid. So all of the connection points are called out here. The aux port and the wash port don't connect to the lid. The aux port just has like a placement call out on here as to where it should go. So we are going to insert the drain straw through the bottom of the lid where it says drain here. Insert it like that. And then we're going to insert the tissue port into the tissue connection point on the lid. So this gold port here onto the lid. This is just a friction fit, so just press that in, make sure it's nice and secure. And now we're going to flip the lid over, push this guy in and engage the slider, just like that, to lock the waste port straw into place. And you can see here there's like a little post there, and you can see that you've pushed this slider all the way to the post, so it's secure there. Alright, so now we are going to roll or fold this bag like a taco or like a hot dog bun, however you want to say it. And we are going to place that in the canister. Make sure it's nice and smoothly in there, not bunched up or anything. Now we'll look at the ports on the top of the lid. You can see there's a call out for the patient tubing, the vacuum tubing, and the waste port cap. So it shows you where everything should go. We'll go ahead and connect the patient tubing to the patient port. This goes to your liposuction handpiece. We'll connect the vacuum tubing to your vacuum port. That'll go to your suction tower. And then we will connect your waste port cap to the waste port. All right, so now we're ready to begin harvesting. Got the canister set up with the easel now. So you're going to turn on the suction and start your procedure. As the surgeon liposuctions, this bag is going to fill up with lipoaspirate. Watch the level here. You can see these volume markings on the back of the bag. Do not exceed 1,275 milliliters. That's going to be the max volume that you can put in the bag. If you exceed that volume, you'll start to have lipoaspirate flowing out of the aux port that's in here and spilling into the system. You're also at risk of bursting the bag if you overfill it too much. So just keep an eye on this. When you're looking at the scale, you can estimate what your final graft is going to be by just taking 40 to 60% of what's in the bag. The final graft is going to vary based on your surgical technique and your washing, but 40 to 60% is a good estimate. So you could just keep an eye on that with this scale back here. If you want to make more space in the bag, you can go ahead and pre-drain some of that waste fluid. So the way you're going to do that is to turn off suction, just pause it real quick, and you're going to switch the waste port cap, the silicone cap, and the vacuum tube. So put this vacuum tube on the port labeled waste and the cap on the vacuum port, and then turn back on suction and let everything drain out. You'll see this level kind of going down as you do that. When you're finished draining, reverse the tubes again and continue harvesting. And then at the end of harvesting, when you have enough tissue in here that you're satisfied, you can swap the tubes again and evacuate any of that waste fluid that's built up. This will just make the washing and draining process go a little bit faster. And then when you're done with that, just turn off the suction and move on to the washing step. So here we are at the washing step. Okay, so the first thing you're going to want to do is retrieve the aux cap and the drain bag that you set aside earlier. Now's the time for those. Next, you're going to lift this lid very slightly. You might find it's a little bit difficult to pry this off of here because of the vacuum level in the system. To make that a little easier on yourself, what you can do is just take these tubes off, set them aside, we're done with them. You could take this cap off too, but I don't want you to lose it, so maybe just keep it connected for now. So what we're going to do is just lift this slightly, disconnect the gold tissue port, and then actuate this slider here, pull it back, and just lift the lid away. And we're done with that, so you could just set that aside. We don't need it anymore. Next, we are going to unscrew the drain straw. And we're done with this, we can set it aside. Now, before we remove the bag, we are going to reattach that aux cap here and we are going to attach the drain bag to the drain port. Now, the reason that we say to attach these before you remove the bag from the canister is that at this point, the aux and the drain ports are completely open. There's no valve in there to prevent fluid from flowing out. So if you squeeze the bag or tip it over, you could have some lipoaspirate or some waste fluid flowing out of that bag through those ports. So just make sure that you keep them in the canister until everything's secured. Now the next step is going to be to take this Puregraft 850 bag out of the canister and secure it on the easel. I'm going to rearrange some things here to make that a little easier. So I'll set the canister aside because we are done with that. And I will set the easel up here. So I'm just going to set this 850 bag on the easel. You can hook it onto these little hooks here. There's 3 hooks. And you're going to drop the drain bag to the floor. Make sure you have this clamp handy. We're going to open that up and let all the fluid, the waste fluid that's left in there, let that flow right out of the system. So once that's stopped draining, once you stop seeing any fluid flowing out of this tube, you can go ahead and close the clamp. You'll hear it click, and then you'll start washing. You can add the washing fluid through the wash port here. See that there? This is just a lure activated connection valve, so you can either connect with a lure lock syringe or with irrigation tubing that has a lure lock connector on the end. And you're going to add your lactated ringers or your saline solution. The wash volume here should be about 50% of what you have in the bag. So let's say you have tissue here up to the 600 milliliter mark. You're going to put in about 300 milliliters of your washing fluid. Then once you've done that, just go ahead and mix the bag. You kind of give it like a little massage here. You can lift it up. Make sure that you're mixing all that tissue with your fluid. Then you're going to open that drain clamp back up and let the waste fluid drain for 2 to 6 minutes. The time here is dependent on how much volume is in your bag. So if you have not a ton in here and you didn't add a ton of wash fluid, it should drain pretty quickly. If you're close to the max, you might be waiting that full 6 minutes for all of your fluid to drain. And then once you've seen that the fluid has stopped draining, we're going to go ahead and close that clamp again. Now you're going to just repeat that wash process. It's recommended that you complete 2 washes. This is just our recommendation. It may vary based on your surgeon's preference. Some people are really happy with the tissue quality after just 1 wash. Others might even want to do 3 washes. But once you're done washing, a good rule of thumb is that the tissue should look like this picture on the right here. It should be just pure gold in color. The next step then is going to be to extract your graft from the bag and transfer it to your syringes for injection. So you're going to use that catheter tip syringe and this Puregraft slider to guide your tissue out through the tissue port. So your tissue port here is this yellow guy. You're going to connect that catheter tip syringe in there, and then while you're pulling on the syringe, just use the slider to guide all that fat down in there. Probably going to need 2 people for this because it's not easy to pull on the syringe and use the slider at the same time. Maybe you're more dexterous than I am, but I think you need 2 people for this. So just pull and push that tissue out. Make sure that the drain clamp is closed during this. Otherwise, you're just going to be pulling your drain fluid, all that stuff that you got out of the system. You're going to just be pulling that back into the bag, and that's not what you want. You can also extract the graft out of the wash port or the aux port. So the wash port is going to be difficult because it's a smaller diameter connection, it's just not going to be as easy to get your fat out. The aux port is an option. So this is a large bore Lohr connection. If you have some kind of system that allows you to connect to this port, you can use it that way. But if you just open this port up and squeeze the fat out, it's just going to come right out. So this is kind of like in case of an emergency port, or if you have a special setup for it. But the easiest way to get your tissue out is going to be through this tissue port. And something to note before you pull your graft out is that you might see a little fluid pooling right there in your tissue port. If you do see that, just extract it and discard it before you pull your graft out. That's just a little bit of wash fluid that's pooled there, and that's not something that you want in your graft that you're giving to the patient, so just extract that first. All right, then once you have all of your graft out of the bag, again, it's like a toothpaste tube, so it should be real easy to get almost all of that fat out. The next step is going to be transferring the tissue from these catheter tip syringes into a Lohr lock syringe for injection. So again, you can use either this guy, this reusable one, or let me show you a disposable adapter as well. So the disposable adapters come in this little package inside your Puregraft box. Just open that up, and it looks like this. So it's the same design, just different material. One's reusable, one's disposable. You can use either. I'll use this one because it's a little easier to see. So you'll connect your catheter tip syringe in there, and then you'll just hook a Lohr lock syringe up to this Lohr lock tip there, and then you'll just slide this guy and transfer into your Lohr lock syringe. Something that you do want to be careful of when you're doing this is that this connection here is not locked. It is possible to, if you don't have a hand on this, to push this really hard, and then your combined adapter and your Lohr lock syringe go shooting off to space. I don't know. So just make sure that you have two hands on this. The Lohr lock syringe is obviously locked in because it's a threaded connection there, but be careful with this guy. All right, and that was all the fun stuff. Now we'll just cover disposal and cleanup. So any of the disposable items that came inside this Puregraft 850 box, those can just be disposed of in accordance with your facility's medical waste policy. As for the reusable components, you're going to want to take everything apart. So take the canister apart from the instrument set. For the instrument set, take apart the two pieces of the easel. For the lid, you're going to want to take apart the drain straw, take off this cap, make sure this is all separate. And then you're going to want to remove any of the rough surface soilings that you see on any of these parts immediately with a disposable cloth or a paper towel. It's best to do this right at the point of use. And then you're going to reprocess all of these items according to their IFU. So these components of the direct harvest kit, so the lid being one component, the instrument set being one, and the canister being another, as well as this guy being its own thing, those all have their own separate IFUs with cleaning instructions and sterilization instructions. We do have a sterilization quick guide that kind of highlights everything at a high level, so it's easier to see the whole process, but anyone who is reprocessing these items needs to read and be familiar with each device's IFU. This is just for everyone's safety and making sure that we're cleaning and sterilizing these items properly. One thing that you do need to note is that the cleaning process for all of these items must begin within 3 hours after use. If you don't, you can start to see some like rough soilings get encrusted on the devices, then that makes the cleaning process less effective, so make sure you're starting that process within 3 hours. Alright, so that was all I had for you in terms of how to use the system. Now we'll start talking about some clinical pearls, best practices, troubleshooting tips that we and our customers have learned along the way that you might find helpful before your first case. So we'll start here with first symptom. What if my bag doesn't fit in the lid or the canister properly? So the first thing that could cause this is the bag not being rolled properly before you insert it into the system. If you don't roll this up nicely, just this way, and insert it, it can get really bunched up and that could be a mess. Just make sure it's rolled and inserted nicely. Next thing that could cause that is if your aux cap hasn't been removed. That'll cause the bag to sit really weirdly in the lid and in the canister. There is a little post here on where the aux cap is that's designed to remind you to remove that cap. It's also a little label on the Puregraft bag itself that says remove aux cap, but if you forget to do it and your bag's sitting weird, just go ahead and remove that aux cap. Next issue that you could have would be your suction not working. First thing that could cause this would be your O-rings not being fully seated. So there's an O-ring here and here. Make sure those are fully seated in the lid, fully seated in the canister. That could cause a slight leak that would make your suction not work or not be as effective. Another thing could be the tubing not connected properly, or there's a kink or a clamp on the tubing. Just clear that, reattach the tubing. That'll make sure your suction gets back to normal. Could be the suction tower issues, either it's not on or the waste canister isn't set up properly. I know this is probably common knowledge, but you're using a new system. You might be a little frazzled the first time. Sometimes you forget things, so that's always something to check. Then the last thing is that if this silicone cap is missing from the waste port, you are not going to have suction because there's just a gaping hole in your system. So just replace that cap, or if you've lost the cap, you can order a replacement, but if you don't realize until right before the case, what you can do is stick a piece of tubing on here and just clamp it with a hemostat. That will seal off that area and that'll work just fine for you. But yeah, we do sell replacements, so just order one of those if you lose it. Next thing that you could have is the waste not draining from the bag after you swap that tube and cap to do the draining. So first reason for that could be if the bag is folded awkwardly. This drain straw will not reach the fluid if the bag's all crumpled up, so just make sure that you reposition that bag if it looks a little funky. The other thing could be that the surgeon turned off suction at the handpiece. I've seen this happen before where you say, okay, we're going to drain it while the surgeon switches sides, but they're used to just turning off the suction when they switch sides, so they turned it off and then it's not draining. So that's something to check. Alright, so this is an issue that could happen while you're washing if your tissue is still red or pink. So that's going to be caused by just insufficient washing, needing to do more washes. So do another wash, repeat it, make sure you're mixing that bag really well to get everything all mixed up before you drain. Next thing that could happen during washing would be slow draining or a clogged bag. So this could be caused by a wrinkle in the bag. Just go ahead and smooth that out. Massage it a little bit. Could be caused by kinked drain tubing. If you have a kink somewhere downstream, just go ahead and clear that. Slow draining could be caused by the bag being overfilled. So if you fill this bag up over the max, there's only so much filter area in here. That filter can get clogged up, and then you're going to have a really hard time getting the fluid through the filter and draining out. That's just, a learning lesson, not to overfill the bag, but to remedy that, you could try like flipping the bag upside down. Just make sure that you're accessing the whole filter area rather than just this filter area down here. That can help you to get some of the drain fluid out. Last thing could be that the outer film has suction to the drain tube stub. So here on the back, you can see the tube stub there and the outer film. This could happen towards the end of draining. Think of like if you have a Capri Sun juice pouch and you completely emptied it out and it gets all like suctioned to itself. Just like pull this back here and you should see it draining better. Okay, so the next issue could happen during extraction, and that would be your graft being hard to extract. One of the causes of this could be fibrous tissue. That's just something that can happen sometimes. You can try adding a little bit of lactated ringers or an air flush to get it out. You can also try the wash or the aux port. Again, be careful if you're trying the aux port, just that you're not opening this up and just letting tissue spill out. Could also be that you use too large of a harvest cannula, so we recommend 3 or 4 millimeters. Anything bigger than that, you might get some chunks that get caught here. It's going to be difficult to remove. Try the same steps as the fibrous tissue and see if you can get it out. Aux cap is a last resort. And then the last thing that could cause that would be just over draining. Like if you left this drain clamp open for a long time and we're doing other stuff and then the tissue got really dry, that can happen. It can be too dry. Just add a little bit of lactated ringers, mix it up until it's a consistency that you can extract. And then the last issue that we sometimes see or hear about is people complaining of low yield. So really the only fix for that is just making sure that you harvest enough. Again, the final graft volume is going to be like 40 to 60% of what you harvest into here, the tissue that you harvest into here. So just make sure that you're over harvesting if you can. If you have a patient that has a lot of extra tissue that you can get, just fill that bag up a little bit more than you think you need. Obviously adhering to the max volume of the bag, but that'll save you from having any issues where you finish the process and you're like, oh no, we don't have enough tissue. You can get another Puregraft 850 bag and just do a whole new harvest if it's a really big case. All right, well that was it. I hope that this video has been helpful to you. Thank you for your attention and for your time. If you still need additional help or you have questions, you could go ahead and scan this QR code that's on the lid. This will give you take you to a site that has some troubleshooting tips, additional videos, and in-depth guides. You could call customer service. They'll be able to help you or connect you with someone that can help you. Or you can just contact your designated Puregraft rep. I'm sure they'd be happy to help. Thanks again for your time today. I hope you have a great time using this system and you really enjoy it. You see all the great benefits that the Puregraft Direct Harvest system has to offer you. And thanks for being a Puregraft customer. All right, bye.